A number of vitamin deficiency disorders are known, and most commonly discussed causes are dietary causes. But in addition to that, a number of non-dietary causes also exist. Just to exemplify, because before I come with these details, in the city where I live, Delhi, this is one of the most polluted cities, and vitamin D deficiency is also very common here. Are the two related? Yes, they are. Reason, because of extreme pollutions, people prefer to stay indoors. So less exposure to the sun. Therefore, vitamin D, the sunshine vitamin, उसका synthesis कम हो जाता है. Now we come to these causes one by one. First of all, decreased intestinal absorption. Now you see, even if diet is sufficient in vitamins, if the absorption in the intestine is not there, there will be deficiency. We are going to discuss first fat malabsorption. All of you know that fat-soluble vitamins, they require proper fat absorption from the intestine so as to be absorbed themselves, because they need bile salt micelles for their absorption. So अगर fat malabsorption होगा, vitamin, fat-soluble vitamin absorption from the gut will also decrease, resulting in their deficiencies. And one clinical point that the patients who are receiving dietary supplementation or dietary therapy, tablets, etc., of fat-soluble vitamin, they are advised a fat-rich diet. Water-soluble vitamins can also, they are, water-soluble vitamins also, they can also get depleted in the people taking alcohol. So alcohol decreases intestinal absorption of vitamin B1, vitamin B6, and also folic acid. As a result of these, deficiency of these water-soluble vitamin will occur. Now we come to a specific case, that is pernicious anemia. Here, deficiency of B12 vitamin is there. This vitamin requires a glycoprotein called intrinsic factor for its absorption from the gut. And intrinsic factor is secreted by parietal cell of the stomach. It binds with vitamin B12 and then delivers it, facilitates absorption from the intestine. अगर intrinsic factor कम हो गया, evidently B12 absorption will also decrease. And intrinsic factor depletion occurs in a condition, in an autoimmune disorder called pernicious anemia. इसके अंदर there is autoimmune destruction of the parietal cells of the stomach, resulting in deficiency of intrinsic factor, resulting in B12 deficiency. Now we are coming to medical treatments. Medical treatments or xenobiotics, you can say. So anyway, first one, INH, isoniazid, which is an anti-tubercular agent given for tuberculosis patient. It forms a hydrazone derivative with vitamin B6, thereby decreased activity of B6. It in fact reacts with aldehyde group of the pyridoxal phosphate. Vitamin B6, pyridoxal phosphate ka. Penicillamine, they also act in the same way. The mechanism of action is exactly like that of the INH, forming a hydrazone derivatives. Third example, antibiotics. Antibiotics, antibacterial agents, they destroy not only the invading microorganisms, they also have got deleterious effect on the intestinal bacterial flora. And the intestinal bacterial flora, all of you know, it is responsible for synthesis of a number of vitamins. And one of those vitamins is biotin. So biotin deficiency will occur if indiscriminate use of antibiotics is there. The result will be biotin deficiency. Here I would like to mention about, I would like to give an interesting example. There is a protein called avidin. This protein is present in the egg. Avidin in the egg, it is present. And when the eggs are consumed raw eggs, so this protein binds with biotin, prevents its absorption from the gut. As a result, biotin deficiency arises. Biotin or B7, it is required in very, very minute quantities. But in these two conditions, antibiotics, evident, even biotin deficiency can arise. In fact, you know, just a trifle, a person has to take 20 raw eggs, तभी biotin deficiency होगी. So that is very improbable in any sane person. So we finish with this also. Now we come to the third point, that is failure of activation of something, just to compete, xenobiotics, humans in their inscrutable wisdom expose themselves to a number of extraneous agents called xenobiotics. We have discussed alcohol. Find out some more examples also. Now, failure of activation, what do we mean by this? Let us see. Failure of activation. Vitamin D, as you know, it's produced in the skin upon exposure to sunlight, and this is called cholecalciferol. Cholecalciferol is activated further, first in the liver and then in the kidneys. In the liver, with the help of an enzyme, it is hydroxylated at 25th carbon position. So this is called 25 hydroxylation. Then further hydroxylated at first carbon position with the help of an enzyme 1-alpha hydroxylase in the kidneys. So only then the fully activated form of cholecalciferol, after it is hydroxylated at first and 25th position, this is called now 125 dihydroxycholecalciferol, also known as calcitriol. Agar activation nahi hoga, calcitriol formation will decrease, as a result of which the deficiency symptoms will occur. Renal rickets. Now I leave it to you. In renal failure, why ricket-like symptoms occur? That is called renal rickets. Of course, there is activation in the kidneys will decrease. 1-alpha hydroxylase activity is improper. Likewise, find out what is hepatic rickets as well. Renal rickets, hepatic rickets. Now you see, another few causes I'm going to discuss. एक है, the requirement is increased in certain conditions. We have already discussed decreased intestinal absorption, medical therapies. Now we are going to talk about the third. If requirement of the vitamin increases. Now, for example, in pregnancy, lactation, etc., requirement of vitamin B12 and folic acid increase. So, borderline deficiency can be precipitated. Fifth position, another important cause, transport protein defect. Transport protein defect. Now, transport proteins, now for example, fat-soluble vitamin A, retinol. It requires a retinol binding protein. अगर रेटिनॉल बाइंडिंग प्रोटीन डेफिशिएंट है, द रिजल्ट विल बी vitamin A will not be delivered to its target tissues. Another example pertaining to a water-soluble vitamin B12, transcobalamin is the transport protein. B12 binds with transcobalamin and the complex is quite large, so large that it cannot be filtered by the kidneys. अगर transcobalamin deficiency होगी, there will be increased renal loss of B12 resulting in its deficiency. So we have discussed now most important causes already. We have discussed decreased intestinal absorption, treatments, requirement increase, failure to activate, and transport protein defect also. Now, just one or two specific example. There is biotinidase deficiency. This enzyme is responsible for recycling of biotin. Biotin, a water-soluble vitamin B7, responsible for carboxylation reaction. So, iska recycling. Recycling means to dissociate it from the एपो एंजाइम. ये एपो एंजाइम है, बायोटीन इसके साथ अटैच्ड है, बायोकोवेलेंट लिंकेज. Biotinidase dissociates them finally so that biotin can be reused. So you can just imagine if biotinidase is absent, the recycling will be hampered, resulting in deficiency of biotin. Why I discuss this condition? Because this is included in newborn screening programs. Newborn screening programs for the treatable congenital disorders. Find out which others are there. Which other treatable congenital disorders are there. One more enzyme, thiaminase. As the name suggests, it hydrolyzes, it degrades vitamin B1, also called thiamine. So thiamine deficiency hogi, B1 will be, sorry, not deficiency, thiaminase will degrade B1 and precipitate deficiency of this vitamin. Fortunately, thiaminase is present in very few foodstuffs, mainly the seafoods, particularly certain fishes, certain others, So this is one of the very rare causes. So I summarize, today we have discussed decreased intestinal absorption, medical therapies, failure of activation, requirement rise, transport protein defects, and then these two specific examples, biotitinase and thiaminase. Thank you so much. We stop.